You're listening to the Public Health Epidemiology Careers Podcast, Episode 16.
Welcome to the Public Health Epidemiology Careers Podcast, where we explore public health epidemiology careers and share tips and strategies to help you enter or transition into the field. And now, your host, Dr. Charlotte Hughes Huntley.
Greetings, everyone, and thank you for joining me today. Today's episode, I'd like to discuss with you how you can use or you can allow your passions for public health to drive your progression through grad school, to gain experience and to prepare you for the career that you want to be in. And even beyond that, if you're already in the career that you want to be in, how you can really use your passion and your real deep interest in public health to help guide you beyond and to grow and to develop even further into your career. Now, if you remember on the last episode, I interviewed Steve Vick, and he's the owner of Nonprofit Ally. And we talked quite a bit about starting nonprofits, and he's a wealth of information and resources for anyone who's interested in starting a nonprofit. If you haven't tuned into that episode, I really encourage you to listen to that. But toward the end, he made a very, very interesting point. He said that, with starting a nonprofit organization, there are so many guidelines and rules and forms and there's a very detailed process, and it varies from state to state and of course different countries. But, he said you have the ability to learn what that process is, to use resources to get that process going. You can, we all have the ability to figure out what needs to be done to start our nonprofit organization. But then the real work starts, and it's our passion for what we do that really drives us to do the busy work every day of running that business, because it is a business. So I began to really think about that. I mean, that's not something that is maybe new to us. I know we've heard that before, but it's so true in so many different areas of our life. So I really began to think about how important that is to tap into that, to identify and really know what your passions are, your true areas of public health where you're the most enthusiastic and you're the most interested, and learn how to really use that to help navigate your journey and help you to, be more driven and so that your journey feels more natural and less orchestrated. It doesn't feel like work, but use that to help drive you and fuel you through that journey so that your heart is in the work that you're doing. So basically, the message one of the messages that he left us with last week, I want to just expand on that a little bit more and talk about it a little bit more and just kind of share my thoughts and hopefully kind of get you thinking a little bit more about how you can apply this in your situation or tweak it and fine tune it if you're already doing that. So what are your passions? What is it about public health that you're most passionate about, most enthusiastic about? What is it that gets your interest, gets you going? If you already know what that is, great. And of course, it's not uncommon to have more than one, highly focused area of interest. So you can be passionate about more than just one part or one topic or one area of public health. But start with one. Focus in on one. And when I'm talking about passion for public health, I'm not talking about, what job do you really want to move into once you've graduated and completed your degree, or what job are you hoping to, get promoted into? That's not what I'm referring to. I'm talking about, beyond the job title and the position, what public health issue do you care most about? Think about a topic that you find yourself naturally exploring. What topics are you automatically reading about, or what catches your attention the most when it shows up in your news feed, or you hear it on a radio program, or you see something that comes on TV? What common thread there? What are the topics that get your attention the most? Or maybe it's a disease or condition. What diseases or conditions do you seem to care the most about, or that you find yourself naturally putting your own effort and energy into without being prompted by an assignment that's due, or because of some other, because it's a work-related issue, but on your own, without any prompting, what do you find yourself most drawn to? Some examples, I noticed, for example, when I was at the APHA conference, the American Public Health Association, there were so many people that were really, really passionate about policy and getting involved with advocating. And I don't mean to sound like I don't care about policy. That's not what I'm saying. But there's a difference in being, concerned, caring, doing your due diligence, doing your part in advocating issues that are important, and having a real passion for something where you really want to roll up your sleeves and get involved. Are you the person that's going to make a contribution, show up at a rally? Or are you the person that's rolling up your sleeves to make the signs and create the flyers and, organize the meetings? I mean, there's some differences. And if you find yourself really drawn to topics like, affordable health care that is made accessible to all populations, that's something that is important to all of us. But for some of you, you are really motivated to get involved in, really advocating for those policy changes. And you're really on top of what's going on, what's changing, more than just to keep in touch with what's going on, but you're just a little bit above and beyond that. And that's an indication of an area that you're really passionate in. And that's important to note. Policy, any type of policy change issue related to public health. If that's an area that you find yourself really, really getting caught up in, that may be something that you're really passionate about that you should maybe focus a little bit more energy into. What about certain interventions? Are there, say, physical activity to, prevent certain chronic diseases or conditions? If there's an activity like a walk to raise awareness of diabetes prevention, for example, or to raise awareness of, I was traveling this weekend, and I remember there was, and I can't remember the exact name. I think it was Girls Run. And I know there was one locally because my daughter wanted to volunteer to help this cause, but it was something about helping to get girls running and active physical activity. So it was like a 5K girls run or something to that effect. And I apologize for not having the right topic, but right name of it. I'm sorry. But what caught my attention was that there were so many people who were really gathered and rallied around this event. As we were traveling, they were actually having the 5K run at the moment that we were passing through this area. And it just sort of caught my attention as to how many people were really involved and really, they showed up super early that day. They were, there were volunteers that were, directing the traffic, that were helping people get the numbers pinned, that were helping people, pointing them in the direction they should go, help navigating the crowd, because there was a lot of people out there. And, that's an example of what I'm talking about. Is there a cause that you find yourself, really getting excited about when it comes down to physical activity, health promotion? Is there, immunization programs, smoking cessation? There's tons of programs and initiatives and health promotion activities, and that are always, we hear about them, we see promotions, but is there something that catches your attention? Is there something that you find yourself drawn to? Do you find yourself generally drawn to things like that, activities like that, where you want to get involved? You want to be, you want to show up early and volunteer. You want to help that cause because it means something to you. And, more than just, oh, that's important and that's good, but do you find yourself really getting excited about those events? And that's something to be able to, I guess, recognize and know where, your super interest areas are. Or maybe it's a population. Maybe there's a particular population that you really care about above and beyond. Now, it doesn't mean that if you're not passionate about it, you don't care about it. I really thought that this was a great event. And this was, I like walking. So given the opportunity, I get involved in an event that has to do with a walk because I like walking. But maybe you really care about the population of children, and you want to see children be more fit and more active. Or maybe it's a population, the children, and you're concerned about, their health in certain conditions that impact children more than adults. Maybe it's juvenile diabetes, or maybe there's any number of events, but maybe you find yourself really drawn to anything that has to deal with helping children, protecting children, impacting their health in some way. Or maybe it's elderly. Maybe you really find yourself drawn to causes that circulate and center around protecting the health of the elderly population. It could be an ethnic group or a gender-related group. Maybe it's men's health or women's health, or perhaps it's a global health that you find yourself really drawn to global health issues and how the different health concerns and situations and diseases and risk factors change from country to country and region to region, and things that can be done to help, collaborate with different countries and populations around the world. So maybe global health causes is something that you find yourself really drawn to, but it's important to know what that is, because that gives you an indication of what you're most passionate about and most enthusiastic about. And really, this is for somebody who's saying, if I asked you what are you most passionate about and you really have a hard time narrowing it down, well, if you start to just maybe think about some of these different areas, look at your activities and your own patterns. If you have a hard time kind of just saying what that is, look at what you're naturally drawn to, what you find yourself being drawn to, and where you spend a lot of your time. And that's a really good indication of an area that, like I said, you're most passionate about. And once you can identify what that is, then you can look for opportunities to be an example, to volunteer, to learn more and apply what you've learned already, what you're doing, what you're learning as you're a student. You can find ways to apply that in those situations. And it feels more natural when you are tied into something that you're already passionate about, already super interested in. And we've talked many times about the importance of volunteering and gaining that experience, as a graduate student, or if you're already a recent graduate and you just need to get some experience to move toward the field that you want to be in, the position you want to be in. It's a natural progression if you can tie into something that you're already passionate about and already really interested in. It just feels it doesn't feel mechanical, and it's not really a chore. Just like, Steve talked about earlier with the work of the nonprofit organization, when it's time to run the business and run the organization, if it's something you're passionate about, then it fuels you and it energizes you to do the work that needs to be done. Sometimes the coursework that you're doing can complement, an area that you're getting involved in. So, I think sometimes it's not so much that we wait for this natural click to happen, but I think it's sometimes you can bring it to the surface, because if you become really aware of those areas of keen interest, then when you're learning material in a coursework, then you're automatically going to draw on those analogies and examples in the area of your special interest. So it'll feel more like those, connections are happening all the time, but you'll be able to find more and more opportunities to take what you're learning in the classroom and then apply it right into the situation that you're in, the organization that you're a part of, the area that you're really passionate about. And then sometimes those opportunities that you find where you're integrating your areas of real interest in those opportunities to volunteer, sometimes those can lead to career opportunities. Not just directly, but indirectly they progress, and you'll find more and more opportunities sort of gravitating toward you or opening up, and you're recognizing them because you're really focused. It's kind of heightened, and again, it feels more natural because you're already interested in it. It's just as natural as and I use newsfeed, if you're, whatever you're looking at on your phone, on your computer, if you're just scrolling through, think of your favorite application or favorite social media. If you're just scrolling through the newsfeed, there are certain things that are going to catch your attention. And just as naturally as you stop and you look at that a little bit further because it caught your attention, if there's something in your Twitter feed about a particular area of interest that, like I said, a disease area or an intervention, a promotion that comes up, a disease awareness category, or something that you're interested in, it catches your attention, you naturally pause, you read whatever that is, you may respond to it or react to it. Well, when you start to work and get involved and connect those with the schoolwork and volunteer experiences, then it'll feel as natural as, those opportunities are going to start coming to you. You click on it, you react to it because you're really heightened and you're aware of it. I hope that makes sense. And I feel like I'm babbling along, but, it's just important that you understand that there's, sometimes there's a natural way that things just flow and it feels right. And then there are ways that you're trying to force it and make it happen. Like, I need to volunteer because I need some experience so I can get this job, but I can't find a way to volunteer. And it just feels difficult and frustrating. Whereas if you just kind of tweak it a little bit and just look at what you're already naturally interested in and kind of go with the flow, don't force anything, but go in the direction that you're already interested. It just feels more natural. And it just, it's almost second nature, and you just automatically start to, you may not notice it immediately, but you just sort of look back at some progress. You realize that you've kind of gravitated naturally in the direction that you wanted to be in anyway. So after saying those things, and like I said, if you know what your passions are, great. Look for ways to connect opportunities with that. And then look for the things that you're doing that, like I was saying, you're naturally progressing into that area, and then maybe go one step further. For example, if you are what I talked about earlier with the 5K walk, and that happens, you're really interested in helping children become more physically active, and you see this opportunity to do the 5K walk, and you say, okay, I'm going to go out there and get involved in the cause, and you get really excited about it and you jump in. Take it a step further. Look for an opportunity to volunteer to help out with that event. And anytime there's a nonprofit organization or really any type of function that's being held like that, there's always a need for volunteers. So if you find a way to get involved on some level that, don't overextend yourself, but just find a way to get involved, then you just count that experience. Make sure you're notating what you're doing, keeping up with those activities, because again, you can get involved in so many different things and sort of forget to keep track of it. And then you don't realize that you have experience along the way. But just start to kind of keep a record of those things. Again, keeping it very natural, but then the next time the opportunity comes around, if it's something that's done every year, then maybe next year when it's time to plan, you may be contacted earlier to get more involved in that activity. And it just, again, continues to flow, and it's just quite natural, and it begins to help you to, you're connecting in with your area of real interest, of special interest, the areas that you're most enthusiastic about. And that spills over then into the coursework. So when you have to go back and do those papers and do that research and work on the dissertation and work on that journey process, then you're being fueled a little bit more to do the work you need to do because you're more excited about the thing that you're trying to move into because you're already getting your hands in it. You're getting involved in it, and it starts to feel more real to you. So you start making those connections, with the information, the material. You're starting to take what you're learning, what you're doing, and you're sharing it with the people that you're working with within that area. And it just continues to develop. And then it feels better. It's less work. It's more natural. And it helps make your experience and your journey a richer experience. So let's just recap something really quickly. A few weeks ago, I think it was episode 13. Okay, so episode 13 was where I summarized my thoughts after attending the national conferences, if you guys remember that. At the end of that episode, I offered you a chance to download the public health organizations, which was a file that I created it includes, it's not an all-inclusive, but it's a very comprehensive Excel file that has many, many, many nonprofit organizations from different countries. And the information included in that file is like the name of the organization, a description about the organization, the mission, the vision, and then a link to where you can connect and find out more about the organization. And I've compiled this list of I don't even know how many there are altogether, but I know there are several different countries and there are different multiple organizations for each country that is listed. And it's designed to give you a good start. And I'm going to link to that document. It's called Public Health Organizations. I'm going to link to that download in the show notes for this episode. So today's episode is episode 16. The reason I'm going to do that is if you have not already entered in, you just enter your email address. If you're not already on my email list for updates, then you enter that in, you join the list. I automatically send that download document to you. And if you haven't received it already, I encourage you to grab that. As soon as you have access, you're able to get to the computer, you're able to download that, because it's a great place to help connect with the message that I'm sharing with you today in terms of your passion. So if you're not already involved in an organization where you feel connected and it's tied into your area of special interest, then start with this list. You can add to it as you search on your own, as you fine tune the area, the country that you're interested in, and you search other organizations and associations in your area. You can add to this list of public health organizations and explore them and find some organization that connects with your area of interest and that has something going on that can connect with the area of your passion, where you're most interested in. And then that's a great resource, a great starting point for opportunities to get connected, to volunteer, and it could be on whatever level that fits your routine and your schedule. Because if you're already feeling stretched thin, you don't want to throw yourself into that and have a major distraction, but you do need to be connected in some way with an organization so that you can gain that valuable experience, really fine tune and sharpen that interest area, and really prepare yourself for entry into the field that you want to be in and for transition into that field. So on the show notes for this page, you'll be able to just enter your information and request that download if you don't have it already. And that will help you to just connect and really get, kind of get the wheels turning and to get the energy rising up so that you can make this journey just that much better for yourself. So if you already know your area, the passion area that you have, then connect with this list and start to look for those opportunities to target. And if you're not really sure where your passions lie, do some of those little, thought-provoking exercises. Start exploring some of your own patterns and habits and try to identify the areas that you are naturally drawn to, the populations or the general locations or the disease topics or conditions, whatever that is that you find yourself naturally being drawn to. Start paying attention to that so that you can identify what your areas, your keen top areas of interest are as it relates to public health. And then, of course, grab that download and use that as a tool to help you. Okay, guys, that's really all I have today. I just really wanted to take a few moments to dig into that a little bit deeper without just dropping in and run to the next thing, because it was, something that he said. It was one part of what he said that was, there were so many great things that he said, but it was one part of the interview that, like I said, he put that in at the end, and it just really kind of made me think a little bit. And I wanted to share those thoughts with you and kind of put together this little outline of ideas and how this could help really, I apply it in my own professional life. I apply it in all of my areas of work, and it really does help me. And I think it's a good idea to kind of revisit, because some things that you're really interested in and you really put a lot of effort in, I'm not going to say you just flip flop and change to something else, 6 months later, but it's a good place to just kind of, I guess a lot of this is fresh on my mind right now as I kind of refresh and get ready for next year. But I think it's a good idea to just revisit some of the passion areas, some of the areas that you're most interested in. Sometimes you'll realize that you develop new interests, and sometimes they can overlap with others, or other things that you spend quite a bit of time on. You may start gravitating away from that and moving into something else. I think it's just a good idea to just refresh and rethink so that we don't get caught up in going through the motions and just kind of passively moving through our job experiences or our coursework and not really taking full advantage of the opportunities that we have around us. And part of being able to really do that is just kind of revisiting these thoughts and ideas and plans from time to time. So I hope this was helpful. And I encourage you guys to check out the show notes so that you can download that file that I created. It's called Public Health Organizations. And please continue to share this podcast with all of your friends and colleagues. I appreciate all of you for your loyalty and, for all that you have been doing and helping this become such a success in such a short period of time. There's some exciting new things coming up for next year, but I won't jump too far ahead of myself. But in the coming episodes, I'll be able to tell you a little bit more about it, as we get closer to rounding up this year and going into next year. So you guys have a fantastic rest of your day.
Thank you for listening to the Public Health Epidemiology Careers Podcast at drchuntley.com.